Think about your vascular system for a second. It's this incredible high-pressure delivery network, right? Pushing blood to literally every corner of your body, nonstop. But it's also super delicate. So what happens when that system fails? When the pressure is too high or too low, or when the pipes themselves actually break or get blocked? Well, that's exactly what we're going to dive into.
So here's our game plan. We're going to start with two really catastrophic failures, a tear in the body's main artery and a sudden blockage in the lungs. Then we'll kind of zoom out and look at the chronic problems, what happens with too much pressure and then not enough. And finally, we'll tie it all together to see how this is all just one big critical balancing act. And it all starts right here with the aorta. I mean, just look at it. This is the main superhighway for blood, coming right off the heart. It has to handle the absolute highest pressure in your entire body. It's a total marvel of engineering, but it's also where our first major system failure can happen. All right, so we're jumping right into the deep end with one of the most dramatic emergencies you can find in medicine, a truly catastrophic structural failure called an aortic dissection. So what's actually going on here? Well, it's not a clot or a blockage, it's a tear. That high-pressure blood finds a tiny weak spot in the aorta's inner wall and literally forces its way in, ripping the layers of that vessel apart from the inside. This carves out a brand new, false channel for blood to flow through. The root problem is that the wall of the aorta itself has become weak. And the way this shows up, man, it's dramatic and super specific. Patients often describe this sudden, unbelievably severe tearing chest pain, and it often radiates straight to their back. And because that new false channel can block off the arteries that branch off the aorta, you get these classic signs, like different blood pressures or pulses in each arm. It is a true vascular catastrophe. Okay, so let's move to our next emergency. We're going to shift from a structural tear in a pipe to a sudden dangerous blockage inside the vessels of the lungs. And this picture, wow, it tells the entire story of a pulmonary embolism perfectly. See, it almost always starts somewhere else entirely. Usually, it's a deep vein thrombosis, or a DVT, which is just a clot in the big veins of the leg. That clot can then break free, take a trip all the way through the heart, and bam, it gets stuck in the pulmonary artery, suddenly cutting off blood flow to the lungs. So, how does that first clot even form? Well, it usually comes down to this perfect storm of three things, which we call Virchow's triad. First, you need slow blood flow. Just picture someone who can't move around much after a big surgery. Second, the blood itself can become hypercoagulable, which just means it's extra sticky and more likely to clot. And third, you might have some damage to the inner lining of the vein. Get all three of those together and the risk of a clot just skyrockets. Now, let's pivot. We've looked at these sudden, life-threatening emergencies. Now let's talk about a much more common, sort of slow burn problem, hypertension. This is all about the damage that sustained high pressure causes over a long, long time. Hypertension isn't just one thing. We usually break it down into two main types. The vast majority of cases, like 90 to 95%, are what we call primary hypertension. That means there's no single clear cause. It's more of a mix of genetics, lifestyle, and just getting older. But for a small group, it's secondary, which means the high blood pressure is actually a direct symptom of some other problem, like kidney disease. And this is what that chronic high pressure does to your arteries over years. On the left, you've got a healthy, flexible vessel. But on the right, well, after years of being pounded by high pressure, the artery gets damaged, stiff, and way less flexible. This creates a vicious cycle that just drives the pressure even higher. And you see where this is going, right? That constant damage, that weakening of the vessel wall, that's a major risk factor for the aortic dissection we were just talking about. When we talk about target organ damage, it can sound a little abstract, but here's where it gets really clear. Just look at the back of the eye. These tiny, delicate blood vessels are basically a window into what's happening all over your body, in your brain, your kidneys, your heart. Sustained high pressure physically beats up these fragile little structures everywhere. So when does high blood pressure go from being a chronic problem to a full-blown emergency? Here's the crucial point. It's not just about the number on the cuff. A hypertensive emergency is when you have severely high blood pressure plus evidence that it is actively causing organ damage right now. Things like confusion, signs of a stroke, or kidney failure. It's the damage that makes it an emergency.
Okay, so we've spent a lot of time on the problems of too much pressure. But what happens when the system fails in the completely opposite direction? What happens when you just can't keep enough pressure in the pipes?
Let's look at two really common ways this happens. On one side, you have orthostatic hypotension. This is basically a plumbing problem. You stand up, gravity pulls blood down to your feet, and for some reason your body just fails to squeeze the vessels and speed up the heart to compensate quickly enough. Then on the other side, you've got vasovagal hypotension. This is more like a reflex gone totally haywire. Some trigger, like stress or even the sight of blood, makes your nervous system hit the brakes, suddenly dropping your heart rate and blood pressure, which can make you faint. And for that first one, orthostatic hypotension, this isn't just a vague feeling of dizziness. There's a really specific definition for it. It's diagnosed when your systolic blood pressure, that's the top number, drops by at least 20 points within 3 minutes of you standing up. It's a clear, measurable sign that the system just isn't adapting like it should. So we've looked at tears, we've looked at blockages, pressure that's way too high, and pressure that's way too low. Let's pull this all together and see the single theme that runs through everything we've talked about. This quote, it really nails it. Think about it. Aortic dissection is a failure of the vessel's structure. A pulmonary embolism is a failure of flow. And hypertension and hypotension are both failures of pressure regulation. They all come back to this incredibly delicate balance that our body has to maintain every single second of our lives.
So, what's the big takeaway here? What does this delicate balance really mean for us? Well, it means our vascular health isn't just one thing. It's this dynamic dance between the strength of our vessels, the pressure inside them, and the smooth, uninterrupted flow of blood through them. And really, understanding that balance, that's the key to understanding our overall health.